Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Towson, Maryland, discussing the advances in pediatric dentistry with one of this area's top pediatric dentists, Dr. Margie Hernandez. Dr. Hernandez received her DDS degree from the University of Maryland and received her pediatric training at the Children's National Medical Center in Washington, D.C., and Dr. Hernandez is widely recognized as one of this region's top pediatric dentists.
Right.
Welcome, Dr. Hernandez.
Thank you very much. It's a pleasure to be here.
Oh, it's our pleasure to have you on, your first time, in fact, on our program, and we've got a lot to talk about. I wanted to begin, if I may, Dr. Hernandez, by asking you if you could please tell us what pediatric dentistry is.
Okay. Pediatric dentistry is the involvement of dealing with children to recognize their oral needs, children from the ages from infants to adolescents, to teens, as well as children with special needs.
Oh, well, that's very interesting. So it covers quite a bit of range there for the kids.
Yes, it does.
And what would you say separates a pediatric dentist from, say, someone out there who's watching who thinks they can just go to their general dentist?
Okay. Pediatric dentists, after 4 years of dental school, then go on to specialty training. And pediatric dentists usually have 2 years of residency or even 3 years of residency, and they are taught the needs, the oral needs of the children. It's just like you wouldn't want your child seeing a family doctor. A child has different needs in medicine, just like a child also has different dental needs. We're also taught to deal with growth and development of the child through the different stages, because there's a lot of development that goes through as the child develops their needs.
That's certainly very good to know. That's a big difference, just basically more training, which is very important, that a pediatric dentist has that a family dentist would not have.
Exactly, exactly.
And at what age would you recommend, Dr. Hernandez, that a child begins going to a pediatric dentist?
So a child should be seen by the time they've received their first tooth, or at least by the age of 1, and this is recommended by the American Academy of Pediatric Dentistry. Okay. Reason being is that children, if we see them at an early age, we can possibly see some growth or developmental issues that a pediatrician might not see. We can also, another big factor is instructing the parents on what they should be doing for a child, even at such an early age, to help reduce the risk of dental decay, and also so they're aware of what is going on in the mouth, which teeth should be coming in if they note anything different than the ordinary.
No, I appreciate that. No, that's certainly very important. It's really important, from what you just told us, for prevention purposes. By laying the right foundation at a very early age, literally from having their first tooth.
Exactly.
Right on through life.
Exactly.
What are some typical dental problems that you see in children?
Okay, I mean, the most frequent problem is dental decay. And dental decay, cavities, is still very prevalent in this day and age. And so again, instructing parents what they should be doing for their children to help prevent dental decay. That's the main one. Again, growth and development with the arches and how they grow, the straightening of the teeth, knowing when to refer a child to see an orthodontist. Again, that's another issue that affects almost every child. And trauma. I see quite a bit of trauma, from bicycle accidents to soccer balls or basketball balls in the mouth, and so those are mainly the issues that I deal with.
And I wanted to follow that up by asking you, Dr. Hernandez, because this is a question we get asked a lot, and we have the pediatric dentist on today, so I thought I'd ask you, the expert, what age should kids begin using toothpaste? Because we've heard varying things, and we wanted to ask the expert.
Right. As far as toothpaste with fluoride, which is the toothpaste that you and I use, not before the age of 2.
Okay.
So until the age of 2, you can use a non-fluoridated toothpaste, or you can even just use warm water and brush the teeth. But you need to use something to get the plaque off the teeth.
Okay.
You know?
And what would you recommend as any preventive measures for the parents out there that are watching that would be helpful to them as far as helping their kids avoid problems that would be coming without these measures?
Right, right. First and foremost, a parent needs to be educated. Just like I initially talked about, what I do at that first visit is an infant exam, infant oral health care exam. So the parent needs to be educated on what they should be doing for their child to help prevent cavities, from diet, nutritional counseling, to how to brush the teeth, how often they should be brushing the teeth, if they should be flossing the teeth. So all of those preventive measures, again, are very important with, preventing cavities from occurring.
Yes.
But the parents have to be involved, and I like parents to help brush the children's teeth until probably the age of 7 or 8, where we can put some sealants on their permanent molars to help reduce the risk of cavities.
Very interesting, and you're absolutely right. It's a partnership. It's a collaborative effort with the child, the parents, working in conjunction with the pediatric dentist to ensure the best results.
Exactly.
And how often would you say, Dr. Hernandez, does a child need to go to a pediatric dentist? What would you recommend?
Definitely twice a year, every 6 months. And again, with children who have special needs or are in braces, they might need to be seen more frequently.
Okay.
But otherwise, twice a year.
Twice a year.
Right.
Unless based on special needs or other things that you mentioned.
Right.
Now, we are literally out of time, and I certainly wanted to ask you before I let you go, Doctor, you and your practice here in Towson, Maryland, have established a reputation for excellence. You're widely recognized as one of this region's top pediatric dentists. I wanted to ask you, what would you say helps separate you and your practice apart from many of the others?
Well, I have been practicing now for about 20 years, and I love the kids. I really have developed a great relationship with my patients, and I have to say my patients love coming in. And probably a big thing is I have a very small practice. I do not have any hygienists. I only have one assistant. So when my patients come to the office, they know they're going to see me, and I see them for everything, from just a normal checkup to any kind of treatment, and they do great, and I love seeing them. So it's a lot of fun.
Well, you give them the personal attention, and you're the one they're going to see when they come, and I think that's very, very important in this day and age.
Right.
And on that note, I'd like to thank you, Dr. Hernandez. It was our pleasure having you on our program. We'd love to have you back on in the future.
Thank you so much. I enjoyed it.
Thank you.